Again, good afternoon. Today is March 1st, 2023. Welcome to this week's edition of Mountain Pacific Quality Health It's Worth a Shot series. This week we will be discussing National Healthcare Safety Network data entry, NHSN data entry. And next slide, please. A few updates just before we get started. For our Hawaii partners, I do have an update as far as mobile vaccine clinic offerings in your area. Again, this is just for Hawaii folks. We've identified Times Pharmacy is willing to go between islands, and I am sharing forward their local pharmacy flyer. Reach out if you have any questions or if I can assist to connect you with Times Pharmacy. But again, sharing forward that for Hawaii, Times Pharmacy has agreed to go between islands to help with vaccination needs, not just COVID-19 vaccines, but other routine vaccines as well. Also, an exciting announcement that I am happy to share forward, ecstatic really to share forward, is we have been able to finalize a two-component document to help overcome the barrier with getting signed consents back, vaccine consent forms for your residents. I will drop in chat shortly, but we have developed an annual multi-vaccine consent form. This would allow you to essentially get that annual consent from your residents, maybe during your care planning or upon admission. And then when that individual becomes eligible for them, there is a second form that you would use for assessing prior to administration. Again, excited to share this form forward. I hope that this helps reduce some of those barriers of sending out multiple consent forms, trying to get them signed, and then administering vaccine. So again, I'll drop those links in the box or in the chat box where you can access those on our website. I'll open to feedback too. There was a spelling error on one of these forms that I sent earlier. It has since been corrected. Next slide, please. As always, add those webinar topics or clinician ideas into chat. We'll continue to meet every Wednesday, and we have just a couple polling questions as, as the norm for the audience today. First polling question, do you order your own house stock of routine vaccines, yes or no? And then if you wouldn't mind entering in the name of that vaccine you currently manage. So for example, maybe you manage your Hep B vaccines, your Tdap, your flu vaccine. That's kind of what I'm after to get a temperature check on that. As we look to the COVID-19 vaccine being commercialized as early as late summer, early fall, per a meeting this last week, the management of vaccines is going to come into play. I'll let a couple more folks take that polling question. Can I bribe anybody? Do you order your own house stock of routine vaccines and enter in that name? There we go. All right, thank you guys as always for participating. We can go ahead and end that poll, Mary. And then the next polling question, please. Next polling question, are you currently implementing enhanced barrier precautions in your facility? This is a follow-up question to last week's presentation. Give folks just a few more moments to answer that. Looks like, oh, just about split. Okay. All right, we can go ahead and end that poll. Thank you, Mary. All right, perfect. Next slide, please. Right, with that, we have our usual weekly look, our weekly snapshot of influenza activity. Again, it is on the decline. However, I do want to just show you guys a heat map for the United States. Although this map is our overall average, our national summary, I'm going to go ahead and screen share it this time. Thanks, Mary. All right, so if you go ahead and look at the CDC Flu Weekly US map, the interactive map, I just wanted to point out, even though our national average is declined and remains low, we are seeing that second wave in parts of our country. So I just wanted to point out that New Mexico's flu activity is very high right now. DC, New York, Puerto Rico is on the rise. Texas is moderate and on the rise. And we do have some neighboring states that are starting to show some small, although small, increases in flu rates. I point this out as we look towards spring break and traveling between states, and just reminding everyone that there is still time to get a flu vaccine for this season. And unfortunately, we are seeing that second wave in certain parts of the country. All right, I'm going to stop sharing. All right, next slide, please. And just a quick peek at our weekly COVID-19 snapshot. Overall, the summary across the United States is we are seeing a decline in cases as a whole, a decline in deaths, a decline in hospitalizations, and an increase in bivalent vaccination rates. I'm going to go ahead and screen share here as well. Again, just wanted to take the time or the opportunity to show the audience today, again, CDC data tracker, live map, interactive map for the United States. Average case for the United States right now is about 71 cases per 100,000, but you're gonna notice that we have some overlap with that map that I just showed you of a second wave of flu, and some increases in COVID-19 cases. And when you look at these weekly case rates, again, the average right now for the country is about 71 cases per 100,000. Again, we're as a whole on the decline, but we're seeing some uptick in some states across the country. Taking a look at Alaska, it's about 106 cases per 100,000. The Dakotas, North Dakota and South Dakota are trending up, and Arkansas, Louisiana, Tennessee. Again, just wanted to show you this interactive map that, although as a whole, we have some trending down when they take those averages, just keep an eye on your state and local activity. All right, thank you. I'll go ahead and stop sharing. And next slide, please. So without further ado, I welcome both of my peers, Lori Chikoyak from Alaska and Tom Vincent from Montana, as we look closer at some of the most common questions related to NHSN long-term care data entry. Lori, Tom, you have the floor.
Thank you so much, Jessie. We really appreciate it. Next slide, please. So we're going to spend the next few minutes for the duration of our half hour together. We're going to answer some questions that you guys have been asking that we've gotten in chats or feedback from other events. So we're going to just answer those. And then we'll take some questions as well. We'll also spend just a short amount of time talking about that new requirement for healthcare personnel influenza vaccination reporting. So next slide, please, Mary. So the first question is relating to error messages in NHSN. And I know we held our webinar Monday on NHSN reporting, and we could even see as we were doing a live demo the slowness of NHSN, because at times it gets kind of bulked down. And then sometimes you may get a data entry error. Like, so what do you do? What happens with that? So if it's lagging or it's not working correctly and you get an error message, I would encourage you to do a couple of things. One, email NHSN at their help desk, and we have that email there, nhsn@cdc.gov. Be sure in the subject line of that email, you're really specific about the problem you're seeing, because that is the key to getting a quicker answer. As you guys know, with the tremendous expanse of NHSN with our long-term cares since COVID, that has not kept up with the amount of people who are serving in the help desk. They're fabulous, but they need more. So do that. And then also anything you can screenshot that you're seeing, I would say that's great, and attach it to an email. Keep those, because if you get, a question from CMS on not reporting timely, those are the things you can use to help back you up that, hey, we really tried to report and this is what was happening and this is how we work to resolve it. Next slide, please. And I think Tom's going to answer this one.
Thanks, Lori. So this next question is pretty common too. What modules must be completed in order to avoid CMP fines? So as it pertains to the weekly reporting, you want to make sure that you report into the pathway data reporting module, and it must be completed for the resident impact and facility capacity, staff and personnel impact, and the therapeutics. And in addition to that, don't leave out the vaccination data as well. This does not include, of course, what Lori alluded to earlier, the new requirement of the healthcare personnel influenza that will be reported annually. And we'll talk a little bit more about that as we go. Next slide, please.
Great, Tom. And just a reminder to everyone, if you have questions about NHSN, feel free to plop them in the chat, or come off of mute later when we do our Q&A if you're able to. And if you're unsure about just plopping that out there for everyone, don't hesitate to just send us a private message, and we will address that when we get to our open Q&A section. So this next question, does it have to be a nurse that submits this data? So do you have to be a nurse to utilize NHSN? And the answer to that is no. There's no requirement for staff to be a nurse. But I will say, as someone who's used NHSN for almost 2 decades, I will say the vast majority of people who are using NHSN are often your infection preventionists, and the majority of infection preventionists do happen to be nurses. However, and I've seen this especially with our long-term cares, the need for spreading out some of the work that we're doing has really occurred. And so we have other people who may be entering data, our data analysts in our organization, or maybe the quality person or some other segment of your staff who are actually entering in NHSN, and that is absolutely fine. Just being sure that you have a methodology for collecting the accurate information each week is important, and then anyone that is an NHSN user, let me be clear, can put it in. So next slide, please.
Okay, my administrator and director of nursing services left at the same time, and our building no longer has an access to report in NHSN. What do I do? There is a form that you can complete, which allows you to change the NHSN administrator, and it's electronic form now. It didn't used to be. And we've provided the link there on the slide. And also consider being a little proactive. As we always recommend, if possible, have an NHSN administrator and a couple people that that both have the clearance and are able to enter data into NHSN. And please, if you are the administrator, NHSN administrator, you are leaving, please take a little time and assist in handing over those responsibilities to the next person.
Next slide, please. And so how do you know if you're submitting your NHSN data correctly? I know this question comes up a lot. And so you need to be sure that all of the reporting sections, the ones that we mentioned a couple of questions ago, are complete each week. And we really suggest that you set a day and a time each week to do that. Don't make it a Friday afternoon. Don't make it on the weekend. The data rolls over every week to CMS from NHSN after midnight on Sunday night. So that is an absolute deadline. But as you're submitting your data in the pathway reporting and the vaccination modules, when you enter each of those sections, they will turn green. If you have started entering but have not completed that data, you will see it show up. Oh, it looks kind of tan. That's what I call it anyway. So but once it's complete, then you will see it for that week in the calendar that shows you that summary. It will show up as green. Next slide, please.
If there were no vaccinations administered in my center this week, do I carry over the previous week's data? Yes, reporting is required weekly and the vaccination module is cumulative. So if no resident or staff changes have occurred, then the data will be the same as the prior week. So you will carry those over for the vaccination modules. I'll just add that the pathways modules are different. Those will be reported as new counts each week. Next slide, please.
And then when do I report the flu data for your nursing home and how often? So this is the new requirement. And currently, and then knowing how CMS is, look for it to change for residents eventually too. But in August of last year, CMS put in place the requirement to do an annual healthcare personnel influenza vaccination summary, so to speak, into NHSN. That is an annual requirement. It is due May 15th. So it is a once a year submission. Now you can enter data at any time. However, the data is overwritten. So if you want to amend it, that is great. You can amend it anytime until May 15th. And then that data is permanently submitted and utilized. So, but I would encourage you to just go in there once and do it honestly, because again, the data doesn't accumulate, so to speak. You're just going to overwrite the data you had in there. As a note, you need to use the NHSN Healthcare Personnel Safety, or HPS, component to enter the data. This is a separate component in NHSN. So NHSN has about 7 or 8 different components to it. And if your facility has been using the COVID module only, you will need to add that component. That is something that only the administrator and not your facility, not in general, but the NHSN facility administrator, just to be clear, that is something that only their role can perform, adding a component. So be sure that your NHSN administrator is up to date, so that they can add that component. Monday, when we did our webinar, we asked folks, we did a polling question, who's using this? Who's used it in our long-term cares? And about 85% of our long-term care said that they were not using that module yet. So I'm guessing even today, the vast majority of you probably have not used it yet. So I would encourage you to get that ball rolling just as soon as possible to make sure that you have everything in place, and be sure that you're tracking all the flu shots for your healthcare personnel and all the information that is required with that. Also, just as a side note, as you guys enter your weekly COVID vaccinations, you probably noticed that in that particular module, there's like 4 tabs, right? So there's the 2 COVID tabs, one for residents and one for staff. There's also 2 flu shot tabs, but the tabs for the flu shots in the COVID-19 module do not meet the requirements of the of CMS. So you cannot use that section to accurately submit your flu shot data for your healthcare personnel. It must be in that healthcare personnel safety component only. Next slide, please.
Sorry, I was on mute. Is there a module in NHSN to report antibiotic use in nursing home? No, there's not. Antibiotic use and antibiotic resistance module in NHSN is for hospital inpatient units only. And the implementation of antibiotic stewardship in long-term care is assessed through the NHSN long-term care facility component annual facility survey. Next slide, please.
All right, if you're talking, you're muted.
Oh, thank you so much, Mary, because I was speaking on mute. I really apologize. So just following up from our previous slide on healthcare personnel flu shots, remember that deadline date of May 15th? I suggest you submit one report. Do that after, quote, flu season ends. I say quote because in NHSN, there's a 6-month window that's considered the flu season. And that is from October 1 through March 31. So anytime from April 1st through May 15th, submit your data once you have it all collected. I also want to say that even though that's the data that's collected, if you're still seeing flu in your area, I know for myself, I live in Alaska, and we quite often, like our flu season may start later and last longer. It happens. And so if somebody hasn't gotten their flu shot, starts working at your facility, you've got a lot of flu going on in your area, and vaccinate them if it's April 2nd. It's okay. So even though you're tracking it, please don't let that discourage you from continuing to vaccinate in April or even into May. Remember that flu shot takes a couple of weeks to work, but I encourage you to think about that as an aside to reporting. So that's kind of some of the questions that we had previously gotten, and we thought we would just answer. I know we have some things coming into chat. If you guys have other questions, we will be happy to answer them. One of the first questions I see here says, I enter the flu data for the entire CAW, which includes the long-term care. Do I need to enter long-term care separately? And the short answer to that is yes, because even though your long-term care and your CAW may even be in the same building, and it may include very similar or the same staff, they are separate entities. They have a separate CCN, so that Medicare number, and it is required that you enter them separately. So you may track them in the same format, especially if you're a small facility. I completely understand that, but be sure that you're entering that data separately into the long-term care, for the long-term care under that particular CCN. Then also be sure that you're counting people who've entered the long-term care during flu season. Those are the people that you want to count. So if you hire someone who works in the lab, let's say, and maybe they draw labs on your inpatient staff or patients, routinely, and they also go into your long-term care and perform lab draws there, you're going to count that person in both places. But if you have someone who hires on, let's say they hire on, as a provider, and they're a hospitalist and they're solely working in your inpatient unit in the same building, but they never cross over to your long-term care, you would not count that person in your long-term care count. I hope that makes sense. Okay. The next question I see is the influenza tabs have been removed. Oh, it's a comment, which is a great comment. The influenza tabs have been removed from the COVID vaccine area, at least on my access they have. So that is great. I know I've been looking in the demo since we're not a specific facility that's reporting weekly. We use a demonstration model and they may not have updated that. I was in it yesterday and my demonstration model definitely still had those 2 tabs. So that is great to know. I appreciate that information. Thank you. Sarah Chen asked, can you show the mirror screening on where to upload this flu document for the annual requirement? So that's a great question. There is, and I know we had a couple of questions come up about this Monday. I looked, there is a CSV document you can use to upload your numbers into the healthcare personnel flu component for the flu requirement. But that whole table is it's actually like 24 boxes worth of data, worth of numbers. And actually there's a whole lot more information in that CSV file that you can upload. But outside of that, there's not really anything else that they're providing currently for that. And I'm not sure if the CSV file will be useful to people. It's not a tool where you're like a line listing of all your staff with their vaccine. It's looking for the summary already there. And so if it's looking for the summary already there, to me, it's easier just to go ahead and put that summary information right into the module. But good question, Sarah. And if I find anything more additional on that, I will certainly let you know. Marcy asked a question. Are the instructions Tom reviewed to reassign roles in NHSN, for example, if an admin leaves, applicable for all settings, i.e. long-term care and hospital? That's a great question. And yes, they are. This was a tedious process in the past, like really tedious, because you had to download and print a physical form. Then you had to get a really high level C-suite member to sign it. Then you had to fax it back into NHSN and wait that eternity you always wait. So they have definitely improved that process, and it is for all facilities that utilize NHSN. So if you're a long-term care, if you're a hospital, if you're an outpatient setting, maybe you're a long-term care hospital or a psych facility, any of those that are applicable can use that to change their administrator. And Sandra, you're welcome. I'm glad we answered that. Oh, Sarah, that is a great question. Sarah followed up with the mirroring document, and she meant the tab that you click on to upload the CSV flu document. And I would have to look that up and see. I don't have a live demonstration model. There isn't one available for the flu, for entering the flu shots for healthcare personnel. But I'll see what I can find on that. We do have, maybe this is a great point to just interject and say, we had really great response to our webinar on Monday. So we're going to do kind of an encore performance coming up here on March 20th. So just in a little over 2 weeks. And we're also going to do a follow-up one on April 10th. And in that one, we'll focus just on that healthcare personnel flu shot reporting. So stay tuned. We will probably address some of those questions there as well. Suzanne asks, on the manual entry of influenza data, I was having problems saving, as it was saying that the location was not selected, but there was no place to choose the location. Has anyone else had this issue? So if you're entering inside the healthcare personnel flu shot section, at the top, you enter the year you're reporting the flu shot season. You need to make sure that that's current. Make sure your CCN reflects your facility and not some other facility that's connected, maybe with your account. I'm not sure. Other than that, I'll have to do some digging. Tom, any thoughts on that one?
No, not with that. I would have to review that to visualize that and see what's going on. Hopefully it's not a technical issue that you're having there. So I would have to review
Mhm.
that first. I'll take a look when we're done here.
Great. And I know we're at the top of the hour. Joyce commented in that she had her NHSN spreadsheet to spin and said it saved, but later saw that it hadn't. So beware. And that's a really good point. If you're having any of those kind of issues, double check. Another reason not to leave this until the last minute each week, because if it doesn't save for some reason, you still have time to put your data in again or remedy the problem you're having. Anyone else have questions? We are at the top of the hour.
Lori, I see one last question we can snag there in the chat regarding when reporting staff, does this include other contract staff, maybe the doctors? Do we report?
That's a great question. And yes, it sure does. So maybe, let me see here. If I could screen share for just a minute, I will show you. I'm working on a tool right now. So I'll just share that tool so you can kind of see the columns. It really mimics what we see. I hope you can see my screen, but this is what it looks like inside that module. There's 6 questions you answer, and then it splits up the personnel. So it includes anyone who's been on site in your facility for at least a day. And by a day, that means they set foot in it. They could stay an hour, 15 minutes, 2 hours, doesn't matter. So if you spend any length of time physically in the building and you fall under one of these categories, they need to be counted. And yes, that does include your LIPs. So whether or not you pay them, the way NHSN splits it is between employees, and simply put, employees are anyone that your facility pays, and non-employees, which simply put are people that you don't pay. So for instance, the other contract personnel may include agency staff who you've hired. The agency, they send a staff person, the agency pays the staff person. That person would fall under the other category. So great question. I hope that helped.
Thank you, Lori. And I would just encourage anyone that has questions, feel free to reach out to us. We're more than happy to get on the line and screen share and provide some one-on-one assistance with NHSN data entry and see if we can help you out. So again, stay tuned as we offer more learning sessions and assistance with NHSN data entry for our long-term care partners. We are recording this session and we'll send the slides out. As always, including some resources at the end of our presentation too. And last slide. Thank you, everyone. Thanks for your attendance today, your great questions. As always, take care, be well. See you next week, same time, same place. Thanks, everyone.
Thank you.